So when we talk about airway in general, it's a little bit different than the conversation around sleep. Obviously, if we're not breathing properly, that can be a daytime and a nighttime thing. The reason the two conversations are linked so closely is that the airway actually gets worse when we go to sleep because those muscles relax, the soft palate relaxes, the jaw is laying back, and so it gets encroached upon the airway. And so if we are identifying any of those symptoms during the day, they're just going to get worse at night. And so those that are not sleeping well, we can see that as behavioral. We can also see that as immune compromised. But other things that we see are just waking up with dry or cracked lips, needing to stop and get water a couple times during the night. Those kind of things that could be pretty obvious. Other thing is just asking their parents to check on if they're snoring, or if they walk in and see them gasp for air, which is called an apneic or a hypopneic episode, where they're not being able to breathe properly, and so they have to gasp to breathe. These are some of the signs that we look for, and some of the things that parents or spouses can look for to know if their partner or their kid is sleeping properly. The best time to consult with an orthodontist as far as airway and sleep is concerned is just as soon as you see that there's a problem. We don't always have to jump in and treat, and there's also partners that we use, but we can help steer that conversation. And so we've developed partnerships with several different professionals in town to help some of those outside issues. But the thing we can address the most is the structural. So are the bones developing properly? Are we growing forward properly? Is the upper jaw broadening properly? Those are the things that open up the airway and help us to breathe properly and more naturally. But obviously, if there are some other things, we need to get some partners. So this isn't something that the orthodontist can fix everything. There's usually other components to it, but we can become a good partner to families and help them find the right people to help them. People ask why airway when it comes to the world of orthodontics, and why it's important to our practice and to me personally. And so it really started a few years ago with my second son, and he was having a hard time sleeping. Obviously, as parents of, at that time, 3 kids, it really affected our whole family. He wasn't sleeping well. He'd end up in bed with us, end up with even some behavioral things throughout the day that just, he was tired. And have been on this path to help my son breathe better, sleep better, have more energy, and just be more healthy. As an orthodontist who can actually help that, I got really excited and started studying airway and how, as orthodontists, we can positively affect someone's airway. So if you're curious about if you need help with your airway, please come in. We'd be honored to assess you and see if we can help. Because our mission statement is to love on people and help them flourish, we're always honored when people trust us with something as precious as their health or the health of a loved one. So come on in and we'll take a look and see if we can help you.